So today I'm going to talk about prehab for a knee replacement. And today's video is sponsored by the TENS 7000. This is the TENS 7000 rechargeable TENS and EMS combo unit, and it can be a great tool for prehab for the knee. So if you're interested in checking it out, click on the link up there. So with prehab for a knee replacement, which is often abbreviated as TKA or TKR, it's really great to do stretches and exercises or prehab before your surgery. And a lot of times people are saying, well, if I have surgery, why am I doing stuff before? Because the stronger and more flexible you are before your surgery, the better your recovery and outcome is going to be. So it's really important to get them as strong, as flexible as possible. All the muscles around the knee, loosen up that knee joint because it's really going to make your recovery that much better. So we're going to start off with some stretching. You're going to need like a stretch strap. If you don't have a stretch strap, you can use a rope, you can use a belt, or even a dog leash if you have a dog, but something solid, so not like a resistive band, but something solid. So we're just going to start off with stretching all the muscles around the knee. So get in a comfortable position. If you can't get down on the floor, you can do this on your couch or your bed to make it a little bit more comfortable. It's really nice to have a loop because then that it goes around your foot or your ankle. So we're going to start off stretching the quad. I'm going to put it on this side because I'm going to turn over onto my stomach. I know some people have a hard time doing that, so I do have other quads stretches that you can do. You can check out my other videos, but this is the one I like if you can comfortably get in this position. So take the loop and kind of put it around your ankle. It's nice to have a long strap because then you can just kind of turn over with it like this. The reason I like the being on your stomach is because that holds that hip in that kind of neutral position. So all you're going to do is just bring it around your shoulder. Make sure you're comfortable. If you want to lie all the way down so you're not arching your back and getting that little bit of stretch in there, don't irritate your back trying to stretch something else out. But all I'm doing here is I'm just pulling that heel towards my bottom until I feel a stretch. I should feel it in that quad area on the front of the thigh. You want it to be a comfortable stretch. You don't want it to be painful. You want to be able to hold it for a full 30 seconds. So just trying to relax. If it's a little bit too much, then just back off of it a little bit. If you need a little bit more, if it feels like it's loosening up as you're stretching, you can just gently pull on it a little bit more. But holding it for 30 seconds and doing that 3 times. If you're just getting a replacement on one side, I like to stretch both sides because you really want both sides to be nice and strong. Again, for your recovery afterwards, the good side is going to have a lot of work to do. So you want that one to be strong and flexible as well. So after you stretch out the quad, flip back over. I'm just going to switch sides so it'll be closer to the camera to you. But ideally you're going to do probably all the stretches on one side and then switch, or you can switch back and forth, whatever is most comfortable for you. So now we're going to go into a hamstring stretch. This time I'm putting the loop on my foot, kind of at the ball of the foot. You don't want it on the toes because then it might slip off. And if it's too far down, you might not really get a good stretch. So usually about at the ball of your foot is the best. So just lying down on your back. I like to prop up my other leg, 1, just to kind of give myself a target, and 2, that takes a little bit of pressure off of your back if your back has been bothering you a little bit too. The goal with hamstring stretch is try and keep your knee as straight as possible, kind of locked out. You don't want to be squeezing the muscles, but bending it will take a little bit of the stretch away from your hamstrings because the hamstrings cross that knee joint. So I'm using the strap to pull my leg up. I'm not actively bringing the leg up. I'm just kind of pulling it up this way. If your knee is bent, see again, then you're not going to feel much of a stretch. So try and keep it, as straight as you comfortably can. And then again, just going until you feel that stretch. You should feel it in the back here. You might feel it at the knee joint. You might feel it in the bottom area because those hamstrings go all the way there. So sometimes you'll feel it more in one place or the other, or you might just feel it everywhere. So again, holding that for 30 seconds, coming down and relaxing, and doing that 3 times. So then you can stay in the same position or you can come up a little bit. Most of the time people like to stay all the way down because that just makes everything a little bit more comfortable. For the IT band stretch, and the IT band is on the outside, and again it goes down to that knee joint. This time you're going to bring the other leg down because you're going to cross that leg over your body. The key with this one is a lot of times people will come up and then just roll all the way over and see the hips and the bottoms coming up, and I'm not really getting a good stretch. So what I like to do is hold the strap with the other side and then kind of put my hand on my pelvis area right here, just so I know that it's staying down. So I'm going to come up just a little bit. Sometimes the height makes a difference of if you're feeling the hamstring stretching more than the IT band, you can come down a little bit, but just kind of go what position is most comfortable for you. And then you're just going to start bringing it over. But see, I'm trying to keep this hip area down because the TFL or the IT band goes into that TFL, that tensor fasciae latae muscle. The IT band is really more of a band, but you're stretching the muscle and the tendon and everything in there. But if you come up and lean over, then you're more going into a back stretch than there. So keep it down, again, holding it there for about 30 seconds. Come back, come down. If you, again, felt like you were getting more of a hamstring stretch with that, go a little bit lower and then try going over, and then you might feel it, again, kind of on the side. You might feel it more at the knee. You might feel it more at the hip where that TFL area is, but making sure you're feeling a comfortable stretch with that. 30 seconds, 3 times. So then you can still lay down with this one if you want to, but this is going to be a calf stretch. I like to sit up while I'm doing it, but again, get in whatever position is most comfortable for you. Now this time it really is important to have it right on the ball of your feet or foot there, because if it's up on your toes, it might slip off. And if you're down in that arch area, you're not really going to get that calf stretch. So all I'm doing again is I'm letting the strap do the work. I'm not actively moving my foot towards me, but I'm just gently pulling until I feel a stretch in that calf muscle underneath there. So again, you might feel it more at your knee, you might feel it more at your Achilles tendon, you might kind of feel it all over in there, but that's getting that nice stretch because those calf muscles cross that knee joint. So again, 30 seconds, relax, and then do that 3 times. So once you get all the stretching in, everything's nice and loosened up, then going into some strengthening is really great too, to get that strengthening out. These are a little bit more on the easier, simpler side. If they're too easy for you, then I have some other videos that you can do some strengthening that's a little bit more challenging. But these really just to start off with, if your joint is really stiff and really sore, needing a replacement, it's probably not going to need a whole lot. You just want to keep those muscles moving and keep them active until you get that surgery. So this one is just going to be a quad set. And basically it's just an isometric exercise for the quad muscle up here. If you want to roll up a towel and put it underneath your ankle to have more of a push, or if you want to roll it up and put it under your knee as a target, you can, but you don't need that. The goal with this one is to keep your heel down. A lot of times people will kind of kick up like that, and that's kind of, it's doing the quad set a little bit, but it's changing the way you're doing it. Try and keep that heel down, and all you're doing is activating that quad muscle and pushing that knee down into wherever you are, the couch, the bed, or the floor. Hold that for about 3 to 5 seconds and then relax. So you should be feeling that quad muscle activating right there. So again, push down, push, 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 holding that 3 to 5 seconds, and then relax. You can do, starting off with just 5 and see how it feels, working your way up to maybe 10 to 15. And you can do those a couple times a day as well as the stretches. So the next one is going to be a clamshell. Clamshells are great to get the gluteus medius muscle. The muscle, or the leg that's being worked, is on top now. So again, I'm just kind of flipping, but ideally you want to flip back and forth and do both if you can. Now clamshells are great. They're really good. You're going to feel it, but it's important to do the right technique, because if you're not doing the right technique, they're going to feel easy and they're going to feel like you're not doing anything. So it's really important. The first step is make sure you're comfortable and you're going to be on your side. Kind of stack your knees on top of each other and your ankles on top of each other. And really, if you can, your feet, your hips, and your shoulders should kind of be in alignment. But the most important part is to keep your hips perpendicular to whatever you're lying down on. So you don't want to roll back this way. You don't want to roll forward. You really want to be up and down, because a lot of times what people do is they'll kind of roll back and do that. But then you're just kind of using the momentum of the roll and you're not using your muscles to do it. So the feet are going to stay together and then the top knee is just going to come up. But kind of like with the IT band stretch, I like to put my hand on my hip just to make sure that it's not rolling. So I'm just going to kind of hold it here. I'm not pushing it, but I'm just making sure that I will feel it if it moves. And all I'm doing is just bringing this up and slowly coming back down. So see, the hip here is not really moving. So if you feel like your whole body is moving and kind of rolling, that's not quite it. It's just bringing that knee up. It doesn't have to go super high because then otherwise you're going to want to roll and then nice and slow back down. So again, if you're doing it right, you might do 3 or 4 and go, oh, that's not really hard. But once you start get going, maybe 5, 6, 7, you really should kind of feel it in that outer hip there where that gluteus medius muscle is. So less is more with these. So if you just want to start off with 5, see how it feels, do a couple sets of those, or if you want to do it for time, just how many you can comfortably do in 20 to 30 seconds, you can do that as well. But again, make sure you're doing both sides because especially in the pelvis area, it all kind of works together. So if you have time, it's really best to do both sides. So then the next one is just going to be bridging. If you've seen some of my videos, bridging is another one of my favorites because it kind of works everything. It works your knees, it works your hips, and it works your back. So it's a great one just to kind of get everything moving in there because even if you're just getting a knee replacement, it really affects your hip and your back as well because a lot of those muscles in the knee come up to the hip and then the hip is connected to the back. So sometimes you'll have pain in those areas as well, even though it might be the other joint that's bothering you. So with a bridge, you just want your knees and your feet in about alignment with your hips. I like to kind of roll up one segment of at a time of my back. You don't have to stop at each segment, but you're not just going up and down with momentum because again, then you're not really using the muscles that you should be moving. Now, if you have a lot of soreness, sometimes bridges will make your hamstrings want to cramp up. So if you push and they feel like they're trying to cramp up, you can bring your heels closer to your bottom. Sometimes that takes the hamstrings out of it a little bit, or you can just kind of lift up just a little bit instead of pushing all the way up, just activating those muscles. But ideally, you're going to come all the way up into that neutral position. So I'm not arching my back, everything's in a neutral position, and then nice and slow kind of rolling back down. The slow movement helps those muscles activate. So again, it's not just going up and down because that's not really working those muscles. If you do a slower, smooth, controlled movement, then that's really going to work those muscles. So again, you can do them for reps or you can do them for time, but really just kind of taking your time and making those muscles activate to get them a little bit stronger. So the other exercises are going to be standing up. So the next exercise is going to be standing hip abduction. So with these, make sure you're holding onto a countertop or a sturdy chair for balance. And then if it becomes a little bit easier, you can challenge more without holding on. But always start off holding on just in case so you can do the technique right. So with hip abduction, you're going to be kicking out to the side. But the important part is to lead with your heel. So it's not just kind of kicking out like this. You want to actually turn your foot in a little bit, and that will help activate all those muscles out on the side. So if I'm holding on, I'm going to shift my weight to the other side and then just kick out to the side, maybe a little bit to the back as well. But again, if you're holding on for balance, just going out and then coming back in. You can put your foot down every time, or if you want to just go back and forth, if you've got good balance, you can do that too. Make sure with this one you're doing both sides because I'm working this side by standing on it and doing the balance, and then I'm working this side by the movement kicking out. So then you definitely want to switch because you're doing different kind of exercises for each on both sides. So same thing, you can do it for reps or you can do it for time, whatever's more comfortable for you. Make sure you're holding on the first time. So the next one is the same kind of thing you want to hold on when you first do these. These are just going to be heel raises. They're just like they sound. Making sure that your feet are about hip width apart. If your balance is really bad, you can go out a little bit further, but ideally you want them to be about hip width apart. So all you're doing is just raising those heels or coming up on your toes. So this one, you want to make sure you're going slow. So again, you're not just going up and then plopping back down. The coming back down is equally important to get the strengthening. So when I come up, I really want to make a nice controlled motion coming back down. So if you don't feel like you can do that well, again, holding on to something to make sure you get that good technique is the best way to do it. So if I'm coming up and then just plopping down, I'm missing out on about half of the exercises. So again, coming up and then nice and slow coming back down. So there you have it. Those were some prehab stretches and exercises for knee replacement. Thanks to 10-7000 for sponsoring our video. And if you're interested in purchasing it, you can click on the link up there. And don't forget to subscribe by clicking down there. And remember, be safe, have fun, and I hope you feel better soon.